want.
No, no. Good. Welcome to the Life with Joey Calvo podcast. I am Joey Calvo. Today, I have an awesome guest today. Um, we're going to be discussing back pain, of all things. Um, Besides her career and everything, what led her to um, be here and talking about back pain. Uh, but first, I want to introduce you to the this drink that I got interested in. It's called Magic Mind. Um, During the time that I tested it, um, it did release some stress. Not all of it. I'll explain why later. Um, but with this product, it's like a 5 hour energy shot. It boosts your energy and focus. It crushes your procrastination and it elevates your mental clarity. It's a matcha tea. The taste is good, but I'm not a matcha tea fan. So, but only this January, they help you gear up to crush your 2024 New Year's resolutions, fully focused. You get 1 month for free when you subscribe for 3 months at https colon// magicmind.com / JAN Joey CA. I went my code Joey CA20. It's an extra 20% off, which gets you 75% off. This lasts till January 31st. So take advantage of it. All right. So now we have the very beautiful Amanda Harris. She is a certified medical exercise specialist. And she is going to discuss not only about her career, but she's also going to explain why back pain is misdiagnosed. So, first of all, Amanda, thank you so much for coming on.
My
I truly
pleasure.
appreciate that. So, let's hear all about Amanda Harris and how she got to where she's at today.
Well, thank you, Joey, and thank you for having me on. I guess the easiest place to start is my own back injury, which happened when I was a senior in college. I was working with horses a lot back then, and I had a horse tied to the wall of a barn, and it was a prefab barn, so it was a barn that was put up, in modules. And he panicked and started to run backwards, and I thought that his halter might break. He had on like a leather halter on his head, or the fittings around the rope might break, or maybe the rope itself. But he actually managed to pull the entire wall down on top of me. And it was one of those situations where it happened so fast, I couldn't get away from him. And the wall actually pinned me face down and was covering me from the shoulder blades downward. And I couldn't get out from under it. It included, I think, 6 stall fronts and very heavy metal fittings. And so I really thought it might be the end. And I didn't realize that there was a girl that was about my size in the barn with me at the time. I thought I was alone. And she came out of nowhere and had one of those superhuman moments where she grabbed me under the shoulders and pulled me to freedom.
Mm-hmm.
And it saved my life, quite frankly.
Mm-hmm.
And she took me to the emergency room that afternoon, and the doctor looked at me and said, "Well, you're very lucky that you didn't break any vertebra in your spine, any of the bones in your back."
Mm-hmm.
He said, "You're going to hurt for a while." And he said, "I just want you to take these muscle relaxers and some painkillers and sit on the couch for 2 weeks, lie on the couch for 2 weeks. Don't do anything." And I said, "Well, physical therapy, anything." Now, you have to understand, this was in the mid 90s,
Mm-hmm.
and it was in a very small town in
Yeah.
Virginia,
Yeah.
and rural hospital. And he
Mm-hmm.
said, "No, no, just lie on the couch for 2 weeks, and then when you're ready to get up, you'll get up and you do whatever you want." And at the time, I taught aerobics. Probably once a day for
Mm-hmm.
5 days a week. And it was
Mm-hmm.
called aerobics back then. We bounced and we danced and we did all this stuff. And so 2 weeks after my really bad injury, I was back teaching again, bouncing around in the gym and having a great time. And, when you're in your early 20s like that, you're super resilient. But a few years later, that injury caught up with me, and I just started getting recurring back pain. And I went to doctors and had X-rays and MRIs taken, and nobody could really explain why I was hurting so badly. And so I kind of started on this journey myself to try to heal myself. And by the time it really became a problem, I was actually in graduate school for exercise physiology. I was working on my master's degree. And I got very fortunate in that along that line, sort of towards the end of my graduate degree, I met an osteopathic type physician who knew how to work with my really screwed up movement patterns that my body had started to compensate with over time because of my injury. And he helped me untangle a lot of it, but he also helped me understand what was at the root cause of it. But at the time, nobody really knew how to tell me to fix it.
Mhm.
And so I went through this crazy journey for probably close to 10 years trying to figure out what to do to solve my own back pain. And it really involved everything from physical therapy to massage to some of these osteopathic treatments. And then I tried everything under the sun fitness wise to try to make myself stronger and more resilient. And it just kept coming back. So what I finally learned, Joey, after about 10 years of muddling around with this and going back to doctors and physical therapists and saying, what else can I do? What else can I do? Is that I had to figure out how to retrain the way I was moving. And I had to do that by retraining my nervous system, not my muscles. And so that is a method that I've been working on most of my career. And because I've been able to solve my own pain, I became quite a crusader about pretty much everybody else's, because I realize how prevalent back pain is now. And so, yeah, so you could say that that delinquent horse of mine really launched my career, right? It was a rough beginning for sure, but I have learned so much along the way, and I feel very blessed to be able to pay that forward and help others now.
Okay. Yeah. As I was going through the little bio that I got when I contacted you, one of the questions they say is, why do they call you a witch?
only a white witch, never a dark witch, right? Like only good magic. Only good magic. And honestly, I do get teased about that a lot by my clients, because there are ways that we can help to release painful movement patterns that are so gentle. It's not like some forms of massage, like I think probably a lot of your listeners have probably had the experience of going to, some sort of a massage therapist where they actually put an elbow into a sore muscle and it hurts like heck, and it's not like that. The methods I use are very, very gentle. And so, usually it's just asking somebody to move in certain patterns that actually frees up whatever has been gripping. And so a lot of times people will say, wow, that was like magic, or, are you sure you're not a witch? It's like, no, there's no magic involved. It's all science, but it does sometimes seem really too good to be true, because it can happen very quickly.
Yeah. Cause I actually went to a physical therapist for my lower back. I don't know if it was I think it was last year, within the past 2 years. And I mean, it was like nothing. It was like, yeah, you're going to do this. And it wound up being like really nothing.
Nothing meaning you didn't get any relief?
No, the relief was like that.
Oh, good.
But it was like going to the physical therapy almost felt like a waste.
Oh.
Yeah, because it kind of like sometimes it would be okay, and then the next day it might act up a little bit, but not as like before. Like I was mentioning when we first started, I went to the ER over the weekend because I was going to work. And I work at Amazon. And so with my job, unloading and unloading trucks, we're pushing carts and I'm pulling pallets with a pallet jack, and so I was waiting for the bus. Bus doesn't show, and all of a sudden I'm starting to feel pain in the left-hand side of the chest. So, and they started to feel a little sharp, like, like I had to bend down a little bit, and it was never like that when I'm standing. So I was like, I didn't want to take the chance, so I went to the ER.
Smart.
I went there. I was there at 5:30 Eastern time. I didn't get back to where I live until about 12:30 in the morning.
Ooh.
They did an EKG because I have family heart issues. So they checked my heart. They, of course, did my blood pressure. And first time they did my blood pressure, they're like, "Oh, you're 191/110." I was like, "Wow," like, and I was here. And so I turned around and I posted on Facebook, and they're like, "You're having a freaking stroke." I was like, "No, I'm not," because if I was having a stroke, I mean, I would have really felt it. But to find out, because I had a respiratory cough, that it pulled the muscle. So all that 7 hours was all about that.
Yeah.
And being I was also just diagnosed with diabetes, they actually didn't check my blood sugar, which actually surprised me. But by 12 o'clock, when they were handing me the discharge papers, I was like hungry. I was like, so I had, before I left the hospital, they give you that little turkey sandwich with the orange juice and the peaches. Well, I took the peaches and the orange juice home. And I ate the sandwich there. So, I felt fine coming home. So once I got home, or before I even got home, I stopped over at the Wawa and got a hoagie because I was like still super hungry. So I wanted to make sure, I was full by the time I got home. So, and I went to work last night, so I'm better.
Good.
But of course I have my remnants. That's now these are how nurses are. I do feel sorry for them. Because they have to go through so much. I mean, there was one lady that was sitting there and she kept looking around and like, she's, of course, people are screaming and all that. And she was like, like, get me out of here.
Yeah.
Like, because this hospital is very busy. All these hospitals in Philadelphia are always busy.
Right.
Especially on the weekend.
Right.
And I knew it. I figured I'm going to walk. I'll probably be there at least 4 hours. Well, like I said, it was 7. So, I didn't panic. I didn't go nuts and crazy and all that. I mean, they were calling me quick to get like the vitals and and find out what's going on and, so on. I mean, they did it, like I said, they did an EKG. They did the chest x-rays. I mean, they were doing everything under the sun.
Well, that's good. Making sure you're okay.
Yeah. And, like I said, and the doctor comes in, says, "Oh, everything's okay." There was no congestion in the chest and no, we did a COVID test. You were negative on that for all respiratory stuff. I was like, well, that's great. That's great news on top of everything else. But it was just like, you pulled muscle. And every time I hear you pulled muscle, I'm like, it was like, that's nothing new. Because like I said, I also became obese. So I'm always pulling something.
Yeah,
if it's not the muscles in the chest, it's the legs. Because I'll try to stretch my leg out sometimes, and I'll feel like a Charlie horse is coming.
Yeah.
And like, if you don't get up fast enough, you're gonna feel it.
Right.
So that was my little background, and I kind of Well, eventually I would have had to bring it up anyway. Um, so, but in reference to the lower back pain,
Mhm.
um, why do they misdiagnose it so much?
You know, Joey, I'm not sure that it gets misdiagnosed so much. I just think that the wholly unsatisfying experience that so many of us have is that it's not being diagnosed, because you can't. The easiest answer is you can't see the faulty movement patterns that I referenced earlier. You can't
Hmm.
see that
Hmm.
visually on X-ray or on MRI.
Hmm.
And so there's no easy way for a general medical doctor or even an orthopedist for that matter to get a clear diagnosis on that. And technically, unless you're in the osteopathic world, maybe the chiropractic world, I don't know that one as well.
Hmm.
There's no diagnostic code for poor inefficient movement, which there's really no other way to say that. It's like it's in the memory of the nervous system. So there's no easy way to definitively diagnose it. So the doctors wind up saying, well, you've just got low back pain, and we
Hmm.
don't know why, because they can't point to it and show you a picture of it. Does that make
Okay.
sense? Like it's just very difficult to pin down. And so there are those of us in the more rehab side of things. Like I
Hmm.
technically don't do physical therapy, of course, but we're on that healing end of things where
Hmm.
we recognize it.
Yeah.
Physical therapists will recognize it because there are very clear signs of it.
Yeah.
But again, it's just hard to pin down. Like you can't point to something, a clinical test, and say, this is the evidence of it. I
Okay.
can see it by watching people move and hearing them talk about what hurts and what doesn't hurt.
Hmm.
Again, it's a little slippery of a diagnosis. Like it's not a diagnosis.
Okay.
Yeah.
So explain what exactly is a medical exercise specialist.
A medical exercise specialist. Okay, so that is a designation that is maybe 30 years old at this point, but it was the designation was originally created to create a bridge between good physical therapy care and fitness,
Hmm.
because what's been missing ever since the insurance companies came into being is this piece between what's considered the end of physical therapy
Hmm.
and returning to, say, more robust fitness or conditioning type activities. Back before managed care, physical therapists could see people all the way up through the early stages of conditioning and then hand somebody off to a coach or a trainer or somebody who did the fitness stuff. And
Hmm.
and they just can't do that anymore because of the way billing is set up. So there's this big gap that's been created. And that's the space that I found myself in. Even though in exercise physiology, I actually was concentrating more on the cardiac rehab side of things, which is why I understood all the tests they were giving you at the hospital there. But I wound up in this space with back pain because of my own personal experience, and really there was nobody to transition me from really good physical therapy into all the fitness stuff that I was doing. I mean I actually did that. I would go from these low level exercises and then jump back into some sort of really vigorous class or really vigorous workout and bust myself up again because
Hmm.
I didn't know how to create those interim stages. So that's what medical exercise does, is it creates that bridge between those two areas.
Okay. You also mentioned movement rewiring.
Yes. So movement rewiring is my nickname for retraining those faulty movement patterns. So basically, the way that your body works after it senses back pain, especially repeated bouts of back pain, that I
Hmm.
mean, it could just be like how you feel after you've been unloading a truck all day, right? Like you
Hmm.
probably had days where you went home and you were like, "Man, my back is barking at me." And so it can be something as acute as that, or it can be more chronic, like what you feel after you've been sitting at your desk for more than an hour, right? Your back might start to ache. But your brain's response to back pain is to simply take away, deactivate, or unplug, if I can use that as sort of a tongue-in-cheek term, the
Mhm.
muscles that are the little muscles that are closest to your spine that allow for all that wonderful movement availability in your spine, but they also are trying to keep you from moving too much and hurting yourself. Once your back starts hurting, your brain unplugs all of that and replaces it with some of your bigger muscles, and it
Mhm.
reassigns those bigger muscles to stiffen and brace you. And that's really in the effort to prevent you from hurting your back more, right?
Okay.
So your listeners might recognize some of these muscles, like the fronts of your hips get really tight.
Uh-huh.
Your lower back extensors, the ones that bend you backwards, so those back muscles that everybody wants to rub, those
Mhm.
can get really stiff and
Mhm.
grippy.
Mhm.
Sometimes even your outer abdomen will make you so stiff that you can't bend forward very well or bend backward very well. So these muscles have been told by your brain to stiffen you so you won't make yourself worse. And
Mhm.
what I do with this movement rewiring concept is simply to unwind all of that. So we try to get your stiff places moving better. And then we work on reactivating those deep muscles around your spine that are meant to allow for movement, but
Mhm.
not allow bad movement, right? So it's literally trying to work with your nervous system. Well, it is working with your nervous system. It's not trying, it actually works. We work
Okay.
with your nervous system to get all those deactivated muscles back online, and the muscles that grip to stop gripping and do what they're meant to do, which is move you through space.
Okay. We actually have a question for you,
Great.
and this is actually from my childhood neighborhood,
Oh,
one of
great.
my former neighbors. Um, and so the question is, and thank you, Sharon, for coming on and watching the podcast. What is your opinion of spinal cord stimulators?
Okay. Well, thank you for the question, Sharon. First thing I'm going to tell you is I am not a doctor. So when I give my opinions, please just take it for what it's worth. I see a lot of people with back pain, but I'm not a doctor. And I would say, in a nutshell, my opinion of a spinal cord stimulator, I have seen them work very well for folks who are stuck in pain. And what I mean by that is the nervous system can become very reactive, very sensitized once you've had back pain for a certain amount of time. And some people have a very difficult time getting that pain signal to turn off. And so I think the application of spinal cord stimulators tend to work quite well for those folks. Obviously, that's something that your doctor would recommend or not recommend, but I have seen them work very, very well. I have also seen people who told me that it worked well for a while and then they had to stop using it because it just was no longer working and they had to have it removed. So it really just depends on your personal situation. But hopefully you're working with a really good doctor who can give you a lot of guidance in that. But yes, they seem to really help some folks.
Okay. All right. Thank you, Sharon. I appreciate that. Like I said, the neighborhood comes and supports. So I appreciate that.
Actually,
Um,
Joey, may I add something real quick to
well,
that?
yeah, go ahead. Go ahead.
So the other thing that I should tell Sharon is that when we have a situation where somebody's using a spinal cord stimulator, I have a client right now that has one. It's kind of the ideal time, if it's working properly. It's the ideal time to start some of the retraining, because one of the things that you cannot do is you cannot use exercise as an intervention when there's too much pain in the body. So pain is what stimulates that muscle cascade that I was talking about earlier, that faulty movement patterning that I was talking about earlier. Pain is what sets that off. So ideally, to start retraining the nervous system to move better, we have to have a low to no pain environment. And so often, if somebody has been stuck in pain for a very long time and the spinal cord stimulator is working properly and they are not in pain, that is a great time to see a professional about movement retraining, so that you can get working on that while you're in that pain-free mode. Hopefully we keep you in that pain-free mode. That's the whole idea.
And she said, thank you very much for the advice.
Yes, my pleasure.
Okay. All right. Um, as we're continuing on, um, what kind of advice would you give those that I can't say are don't want to go through the physical therapy. They want it like you did, muffled around for 10 years to find out what's causing it.
Mm-hmm.
What's the best exercise that you could suggest that could help alleviate that problem?
The movement problem
Yeah.
that we were talking about.
Yeah.
Okay, so I think there are two questions here. One is what would I suggest for people who don't want to go through physical therapy? Is that right? Is that the first question?
Well, like, nothing against what you do, but they want to try to, they don't. The best way to say it is, they're stubborn people, and
there are.
Yeah, I will admit it. Like I said, if I didn't have that, even with the pain, I was still going to try to go to work.
Yeah.
So, my family's kind of a little. My father went when he was alive, and when Sharon was on, she would tell you about the same thing.
Mm-hmm.
We were stubborn. We didn't want to go to the hospital if we didn't have to.
I understand.
So that's what kind of part of that question was.
Mm-hmm.
Some of them that are, that don't want to take that chance of going to the physical therapist or the doctor and saying, why is this happening? And they want to solve it themselves.
Mm-hmm. Okay.
So that's what the question really was.
Okay. So the first thing I'm going to say is, please, 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 at least go to the doctor. Mm-hmm. And the reason I say that is that although I live and operate in the world of back pain caused by muscles and soft tissue, mm-hmm. and sometimes injury, right? Mm-hmm. There are other things that can cause back pain. There are things like kidney stones, mm-hmm. And there are things like organ problems, other organ mm-hmm. problems. I mean, you could have a kidney problem. You could have, there are people who get UTIs and have back pain. There are tumors that can cause back pain. Mm-hmm. So I believe it is very, very, very important that if you've been having back pain, you at least go to the doctor and mm-hmm. get it checked out. Now, if they rule out all the scary stuff, all the organ related stuff and all of that, and they come up with this sort of non-answer for you, mm-hmm. then it probably is a movement problem, like mm-hmm. a faulty movement problem, like what we've been talking about today.
Yeah.
And if that's the case, then really the decision lies with the individual, of course. Mm-hmm. If you don't want to go through physical therapy, you don't have to. Mm-hmm. But I think you will probably find that your results will be a whole lot better if you do, because here's what happens if you mm-hmm. don't address faulty movement patterns. Those muscles that I mentioned that were gripping, the fronts mm-hmm. of your hips, your lower back muscles, some of your other leg and abdominal area muscles that are gripping. And when I say gripping, I just mean that they feel really tight. Most people mm-hmm. tell me they just feel tight, and mm-hmm. sometimes they feel sore, achy, mm-hmm. almost like a toothache, right? Mm-hmm. So what happens over time is those muscles gripping start changing the way your joints are moving. Mm-hmm. And when you start changing the way the joints are moving, it creates more pressure on some of those joints. Mm-hmm. So we start hearing about knee pain, hip pain, sometimes even shoulder pain that mm-hmm. arise from this muscle imbalance, all this gripping. And so it can actually start causing more problems, and you can wind up with arthritic issues that you didn't have before. Like, a lot of people think arthritis is just a byproduct of aging. And for mm-hmm. some folks it is, but not for everybody. And I would argue that a lot of arthritis can be prevented if you can keep your body moving well. So, of course, it's always up to the individual about whether they want to engage a medical professional or an allied medical professional like me to help them through that journey. But the risk of not getting some help and learning how to move better is mm-hmm. that you're going to continue to have more pain and more problems in other areas of your body, not just your back, in the long run. So, I have an online course people can take, which allows
Mhm.
them to actually do exercise and movement progressions in the comfort of their own home.
Mhm.
But if you go through any of my course materials, the first thing it says is, I want you cleared by your doctor or your physical therapist before you start, because we want to rule out anything that needs medical attention.
Okay.
So that's what I would say, Joey, is my really long-winded answer to your short question. Is it's
Yeah.
always up to the individual, but I would beg any of your listeners, please at least let a doctor look at you and make sure that you rule out all the scary stuff. And then
Mhm.
the rest is up to you.
Okay.
Like you can choose to engage a PT or do a course like mine or anything like that, but at least see the doctor and make sure the scary stuff is ruled out.
You just mentioned about arthritis
Hmm.
and being at you were mentioning about what happened to you in 1993.
Yeah.
I actually have someone close to me um has horses,
Hmm.
was diagnosed with scleroderma in
Oh.
2016.
Hmm.
um this person has just been told they are in the early stages of osteoporosis and arthritis.
Hmm.
Um, and so this person just found this out like within the past 2 weeks. Um, and being the support that I try to be,
Hmm.
in reference to it, as this is going on, I mean, she does try to go to the gym.
Hmm.
Okay, so she is trying to go to the gym.
Yeah.
So, um, but but this person worries about you know, you know, where she gets to the point of, you know, am I going to be in a wheelchair next?
Yeah.
Because because of course with scleroderma, the skin tightens and everything.
Yeah.
And when this person was diagnosed, I showed that video of this 30-year-old woman who was diagnosed with scleroderma, and it freaked her. It freaked them out. It freaked them way out. And I was like, well, this is the worst that can happen. You know, so for the past, we're coming on 8 years.
Hmm.
Um, this person's done everything possible not to be that person, but
Yeah.
now it's starting to catch up a little bit, and so for something like that, I mean,
Mhm.
they're going to the doctor, of course. They were actually going through a research trial at the time for it as well.
Mhm.
Um, what would you, especially because of the three horses and the two mules
Oh.
that this person has?
Mhm.
Um, what kind of advice would you give that person?
Well, that's a good question, and I know that's coming from your heart there, because you I can tell you care about her. Um, I will be honest that I have not worked much with scleroderma.
Mm-hmm.
I think I've only known one person with it, so I don't know as much about that condition.
Mm-hmm.
Uh, I don't really feel great about commenting on the scleroderma condition.
Mm-hmm.
The arthritis condition I know more about, of course, and it sounds like, I mean, I guess they're saying she has osteoarthritis, or are they suggesting
Yeah,
rheumatoid?
something close to that.
Yeah. So, I think a lot of times somebody who's got multiple concerns like that, that you've got the scleroderma that definitely has issues with the skin tightening, and that's going to affect your ability to move. And then the arthritis obviously is going to affect the joints ability to move. And then you've got osteoporosis, so you really want to make sure she's strong enough that she doesn't become a fall risk. You don't
Mm-hmm.
want her to fall.
Right.
um, so somebody like her, I would really direct her toward a good physical therapist or medical professional who can help her navigate that. I mean, I would go toward a PT for that. honestly,
Okay. Okay.
because they've got the expertise to handle all of those scenarios.
Mm-hmm.
And even my profession as a medical exercise specialist, I think there are probably those of us around the country that have more expertise in scleroderma than I do, that would feel more confident in helping her manage her situation. But
Okay.
ultimately, that's what we're talking about, right? Like, it's we're
Mm-hmm.
not looking for a cure at that point. She's got
Yeah.
a chronic situation, and what
Yeah.
we really want to do with that is manage that as best we
Right.
can, so that
Yeah.
she is continually able to move and
Yeah.
do things around the farm, and enjoy her life, and stay strong and mobile, and not let these conditions render her in a wheelchair. So I love that she actually has she apparently loves to move and loves to be outside, and so she's
Mhm.
got a lot of motivation probably to
Yeah.
keep moving.
Yeah.
So yeah,
Yeah.
I
So.
would steer her towards a professional, either an allied health professional like me, like a medical exercise person, or a PT, who can literally teach her how to manage her conditions with movement and exercise in ways that keep her from hurting any more than necessary, and keep her as mobile and able for the longest time possible.
Okay. Let me make a notation. PT. Okay. All right. So as we are closing out, because I've run out of questions and concerns, and as you know, as we're closing out,
Mhm.
how can people reach out to you and about that free course that you were mentioning?
Yes, absolutely. Well, my website is reconnect.com. That's RE-KINECT.com. And in the next 2 weeks, I'm going to be giving several free live online workshops. So if you go to my website, there's a pop-up that'll come up that will invite you to save your seat for the workshop, and I would love to see any of your listeners there.
Mm-hmm.
But it's literally teaching you how to unlock low back pain with movement. So it gives you a little bit of insight into my methods, how we do what we do, and seeing if it feels like a good fit for the person who is viewing that content. Hopefully they learn some things that they can get started with right away as well. Like in the workshop, the reason we call it a workshop is I want you to move. And so when you come to the workshop, you want to be ready to get down on the floor and do a few very gentle exercises, no equipment needed. It's just going
Mm-hmm.
to give you a little taste of the types of movements we use to help you resolve back pain. So that's
Okay.
probably the easiest way to see what I do. I also have a YouTube channel,
Yep.
and that YouTube channel is just at Reconnect, same spelling, RE-KINECT.
Right on the bottom of the screen, I have it.
Oh, perfect. And then you can follow me on Instagram too, which is
Okay.
Reconnect RVA.
Okay.
So I don't think there's a hyphen in the Reconnect for the
Okay.
Instagram
What
handle,
is
but
it?
it's Reconnect RVA. Mhm.
Okay.
RVA being Richmond, Virginia, because that's where I
Yeah.
am. But
Okay.
yeah.
All right. One moment.
And you can contact me through the website. So if
Yeah.
anybody who's listening has any questions and they want to talk to me personally, I would
Mm-hmm.
love to talk to you. So you can contact me through my website, and I would be
Okay.
happy to set up a call.
And you said at Reconnect.
Yes.
Rick
So at Reconnect is my YouTube channel, and then at Reconnect RVA with no hyphen in it is my Instagram.
Okay.
Mhm.
Instagram and on YouTube. Oop, there we go. Okay, there we go. Give me a moment. I'm going to put that up on the screen. So that way, as we're going, people will see it and they can. So hopefully that's all correct.
It is
Um,
good.
yeah. So again, thank you so much, Amanda, for coming on. You're always welcome to come back on. You know, if anything new comes up, just let me know. I will automatically open that door and say, "Hey, let's do it." You know.
Oh, thank you,
Um,
Joey. I
yeah,
appreciate
you're truly welcome. Thank you for the advice. Hopefully, the listeners and that special person will get the idea um, on how to be better and actually working on their lower back and knowing that, it's not, it's common and it can be fixed, but it has to be fixed the proper way and not the stubborn way. As I would say it.
Well.
As I would say it. So
Yeah.
again, Amanda, thank you so much for coming on. And thank you everybody for watching this podcast, listening to the podcast on anchor.fm/Life with Joey Calvo. Check out her website, www.re-connect, that's KINECT.com. Check out her YouTube channel. Reach her out on Instagram, Facebook. Oh, no, Instagram. Sorry. Just Instagram. You got to check out Threads. Threads is good. Threads is actually better
Okay.
than Twitter. And it goes off your Instagram.
Okay.
Yeah.
I'll have to check it out. Thanks for the tip.
Yeah, because when I promote, I have the YouTube channel, of course. I have the Instagram, and actually, when I send my guests the information of the audio and the video, there's a website. It's called Podpage. And what they do is they take it and they put it into a website. They actually set up like a little website for the podcast that people can listen to it on as well.
Great.
And I could even give you a suggestion of like something like this.
Okay.
Of doing a podcast like this. I mean, it didn't cost me much of anything to really start this. Like that link I gave you that brings you onto this YouTube. Doesn't cost me.
Okay. Great.
Yeah. And then, like I said, the anchor.fm doesn't cost me. And that goes through Spot. That actually was bought by Spotify within the past year and a half. So it's actually run by Spotify, and they've been great. So I mean, if this was something that would interest you in even expanding your practice, even, I mean, here's the platform.
Great.
And it's safe. I mean, I don't make much off of it, but I mean, it's something.
Yeah.
I mean, if this interview brings hundreds of subscribers, thank you. If it brings one, thank you. But if it gets a lot of views, I'm also thankful for that too. And again, Amanda, like I said, thank you so much for taking your time out and spending it with us. And hopefully a lot of people, like I said, picked up everything possible about lower back pain and what to do about it and how to do it. And and again, I thank all the listeners and all the viewers and Sharon as well for the question. Even though it was a little outside of the lower back, but it was close enough to it.
It was in that wheelhouse. It was perfect.
Yeah. All right. So thank you everybody for watching and listening to the Life with Joey Calvo podcast. My name is Joey Calvo. Folks, have a great day. We're going to have another podcast tomorrow and another podcast on Thursday. And so far, February is going to start looking hot. Because I got a lot coming up that I'm going to be explaining within the next week or two. So everybody take care. Amanda, thank you again.
Thank you, Joey. Thanks for having me.
All right. You're welcome. Give me a moment.